Hello, and thank you for joining me today. My name is Jocelyn Donovan. I am the CPNP for Niwasa Kandaswan Tech. Today, I am going to talk to you about post-birth recovery. Now, the days and weeks after delivery can seem a little surreal. You won't be getting regular sleep. Your body is still healing, and you'll have breast milk coming out of places you didn't even know existed. I'm hoping to walk you through what to expect during this recovery period and when you should seek help. After birth, you will bleed heavily from your vagina. This blood is from the lining of your uterus that is now shedding, and it will be heavy blood for at least a week or two, and then it will calm down and it will be sort of more like a typical period, but for another few weeks. I found adult diapers the best way to control this bleeding. After birth, it is unsafe to put anything inside your vagina for 8 weeks. So that includes tampons and menstrual cups. So the only real way of controlling this bleeding is with pads or adult diapers. And personally, I chose adult diapers. I found them the best for controlling the bleeding, not having any leaks, and they were actually really comfortable.
Let's play a little bit of true or false this time. True or false? Passing large blood clots is normal and to be expected. False. Passing blood clots larger than a plum can be dangerous. You should contact your midwife doctor or go to the hospital if you pass a large blood clot or if you feel dizzy or lightheaded.
Smaller blood clots, the size of grapes or almonds, are to be expected and typically harmless. However, please talk to your doctor or midwife if you have any concerns about your postpartum bleeding.
True or false? Your uterus will return to its pre-pregnancy size in the weeks after birth. True! Your uterus will shrink back down to size in the weeks after birth, give or take a few millimeters.
If you had stitches after your birth, vaginal or cesarean, they will dissolve on their own. However, if you had staples in your abdomen from a cesarean delivery, then you will have to have a doctor remove them when they see you again. If you delivered through a C-section, you will likely have to stay in the hospital for 3 or 5 days. While you may be eager to get moving, you will have to take it easy for a few weeks. You will have to avoid heavy lifting and using your abdominal muscles, and you will need help caring for your baby and for yourself. You will have pain in your abdomen, and that's to be expected for at least a week, and you'll need to take pain medication for that.
Monitor yourself for signs of infection, such as pus around the stitches, red streaks around the incision, and fever. If you have any of these symptoms, please seek medical help. True or false? You may have green or yellow discharge around your stitches as they heal. False! If you have any yellow or green pus or foul-smelling discharge around your cesarean or perineum stitches, go to the hospital.
If you delivered vaginally, your perineum may be a bit sore for a week or two. I sat on a pillow if I had to sit up on a chair, and that helped me. Otherwise, just lay down as much as you can. But that should heal up on its own within a week or two. And at 6 weeks, you'll have an appointment with your doctor or midwife to talk about how the baby is doing and also how you're healing. Make sure to be as honest as possible. Your healthcare provider really is just there to help you. So make sure you answer everything honestly, even if it's a little embarrassing.
True or false? It can be difficult to have a bowel movement postpartum. True. It can be difficult to pass stool due to hemorrhoids and or swelling and or dehydration, but it should not be impossible. Talk to your doctor if you are severely constipated.
If you had an epidural, it is common for your back to be sore for about a week, but please tell your healthcare provider if it's painful or if the soreness does not go away in a week.
True or false? Severe headaches are typical after birth. False. Headaches that are not eased with medication are not typical. Contact your doctor or midwife if you are having severe headaches, especially if you had an epidural during birth.
You're going to need help during this phase. Your baby will be breastfeeding 10 to 12 hours a day, and you'll be sore and emotional. You'll still have to eat and sleep and shower, at least sometimes. If you are in a relationship, hopefully your partner can take at least a week off to help with this time and with this transition. If you're single, reach out to family and friends. Everyone needs help postpartum. You don't have to do this alone. Post-COVID restrictions, you can reach out to me and I'd be happy to come and hold your baby for an hour while you have a shower and get something to eat. Please reach out to the resources around you. Nobody can do this alone. You deserve help. Thank you so much for joining me today. I hope you learned a little bit about what to expect from the postpartum period. And remember, you can always call the CPNP number on our calendar to chat. Thanks so much. See you again.